Kma for inviting me to join this wonderful conference. And my name is Brian Chen. I'm the medical doctor, and I'm now the Deputy Secretary General of Taiwan Medical Association. I prepared some of these regulations with me, and in Taiwan, the budget is designed by a committee called the NHI, National Health Insurance Committee. And the committee will set a budget according to previous year's health expenditure with a little bit increase in the amount of budget. And the amount are increased due to two factors. One is called the non-negotiable factors. It means that the population aging and more severe of the disease, and some you cannot avoid, like you have a flu pandemic, or like you have enterovirus infection in the community, will cost a lot of money, so it will add up for the payment. And the other factor is called the negotiable factors. That means the caregivers have to negotiate with the payer and the users. Because if you want to introduce a new drug into the medical health system, or introduce new technologies into the insurance, that all costs a lot of money, like billions of money. So you have to negotiate what are the new items you want to put into the insurance. And after consider all these factors, they set up the amount of budget. And the budget then will be allocated to different segments. We have global budget for the primary health care, global budget for the hospitals, for dental department, dentist, and also for herbal medicine, 4 different departments. And when I'll take the primary health care as an example. When we have $50,000 billion last year for total global budget. 1/5 of the budget will go to the primary health care, depending on the factors I mentioned before. And then when it goes to primary health care, it will allocate to the different regions, like the North region, Middle region, South region, East region of Taiwan. And the allocation are according to the recent year health expenditure data, such as population death rate, population growth rate, and age-adjusted expenditure. And it will also allocate the budgets for low health resources area, such as rural area, for island area, or some places are poor funding. And this is basically the idea of how we allocate the global budget. So basically, it does not depend on the large size or small size of the hospitals. No, we just see as a population. Based on the global budget, that means the budget is limited. Let's say we have the total budget for like $10,000 for these 100 clinics, and each clinics, we also use the fee-for-service, like the Korean fee-for-service. So each clinic claim their insurance to the NHI based on how many patients they treat, how many medication they use, how many medical procedures they give. So each of the clinic will have their claim data, how much they claim for the insurance. Every month, we have monthly basis payment. Let's say total 100 clinics, they claim for $20,000 of the dollars on a monthly basis. However, the limit is 10,000, right? So everyone gets 50% of the money you claim for. Let's say the first clinic, they claim for 1,000 in this month, they only got paid for $500. And that is how we do not give the clinic the dollar, we give them the point. Let's say this clinic had 1,000 points this month. However, each 1 point equals to how much money we do not know. It depends on totally of the claim. The average point, 1 point in Taiwan, is equal to $0.9 right now. You know, in Taiwan it's the same. We also use the fee for service. And in Taiwan, the co-payment does not go to the doctor's pocket. Doctor just get the co-payment for the NHI. So the NHI will sampling the claim data, the chart, and gives to the peer review. They will find some experts to see your chart. I think that's maybe the same with the Korean. And those experts, they will see if the medical procedure or the drugs, they fit the indication on the professional view. If did not, they will say, oh, we should not pay for this. It's called a peer chart review. However, if the procedure or drug, they think it did not fit the indications, they not only do not give you the money, they also have penalties. Let's say, if they think 100 point was not a fit for the insurance, they not only deduction 100 point, they also give you 5 to 15 times penalty. So it will be deduction for 5,000 points, even 15,000 points, 5 to 15 times. So under these regulations, the doctor will very careful to choose what they should claim for the insurance. The idea comes from the sampling ideas, because basically, like you see 1,000 patients, and they only sample 1/5 of your claim data, not all of the charts. So they found errors, they have to time the sampling the idea. You choose only 1/5 of the sample. So let's say maybe you have errors in this sampling, and the total population, you have to time 5 to 15 times the penalties. That is the sampling ideas of sampling. But even this have been done for more than 20 years. Taiwan's physicians are very, very much against these policies. That is the big problem. They think there is we say that black hand controlling behind the system. They choose those, the doctors thinks, they choose, this NHI, they choose those physicians are in favor of protecting the NHI to be their experts. But actually, the NHI, they will send the announcements. They call for the specialties society to recommend those experts, and they also call to the medical associations for them to recommend the experts. Yes, but actually, how they work on this choosing of the experts, no one knows.